name is Riley. I'll be your nurse today. I'm going to go wash my hands and I'll be right back.
Perfect.
Wash my hands. All right, I'm going to provide privacy.
Thank you.
May I have your full name and date of birth, please?
Wendy Broik, 8/27/94.
Perfect. So we're going to do a head-to-toe assessment on you. We're going to start out getting your vitals. So first I'm going to get your blood pressure. I don't have a cuff on me, but if I did, I'd put the blood pressure cuff on her. We're going to act like I'm doing it, you know, the full effect. So you straighten your arm out for me. Do you know what your blood pressure is normally?
No, I do not.
It's 130/90.
Okay, I'll take it. If that's
Then I would get her pulse. So I'm actually going to count it. All right, it was about 68 beats per minute. That is good. You want it between 60 and 90. Okay? All right, and then I would check her respiration. So I would breathe normally. I'm just going to watch your chest rise and fall for 30 seconds. Perfect. So 16. And then I would get her temperature as well. I don't have a thermometer on me, but I would also get that too. Beano, go. And then I'd also get her O2 stat, since I don't have one on those, but then I would also get that as well. And then I'd also ask if she's in any pain today. Are you in any pain today? Perfect. And if she was, I would do it on a scale of 0 to 10, and then I would ask her what makes it worse, what makes it feel better, when did it start, how did it begin, something cause it, all those questions. All right, and then we're gonna start with the head to toe, if that's okay. All right, so I'm gonna start feeling your head. Is it okay if I touch you? So I'm gonna feel for any bumps, if there's any pain when I touch you, is there any pain, any lesions, any changes in thinning, texture?
Right.
All right, then I'm gonna look at your face, look at your complexion. Looks good. Will you please smile for me? Frown, act surprised. Sorry, I know it's always awkward, but we're looking for symmetry in the face. I'm gonna pull down on your eyes. Is that okay? All right, so I'm looking at your conjunctiva. Looks good. It's pink. It should not be red or yellow. All could be signs of some issues. Yellow, jaundice, red could be irritation in the eyes, okay? Any changes in vision at all? Do you wear glasses or anything?
Sometimes.
Sometimes?
Yeah, like driving, and if I'm working like on my computer for an excessive amount of time.
Okay, fair enough. All right, I'm going to shine this light in your eye. I'm looking at your pupil combination, okay? We do it twice to both sides. Looks good. All right, so I'm going to watch my pen light with just your eyes and follow it just your eyes. Do not move your head, okay? And I'm going to move it forward. Did you have any changes of vision when I brought it towards you, or could you still see it clearly?
I can still see it.
Okay, so accommodation kind of tests when you can see things from far to nearsighted. So if like you can't really focus on it, when it gets closer, you could be like more farsighted. If you can, or if you can't see it back here, but you can see it way closer, you could be more nearsighted. Okay. So I'm also going to check your nose, so it's okay if I look inside. Any changes in breathing? Any feelings like obstruction at all?
Just seasonal allergies.
Seasonal allergies. Okay. So will you hold one nostril closed and breathe in and out? And then the other one? Okay. Any trouble breathing at all? Okay. stop it. Sorry. Will you open your mouth for me? Go, ah. You smile. Do you go to the dentist?
I do, I try.
Yeah. More than I do, probably. Do you have any problems with swallowing? Getting a dry mouth? Okay, perfect. So I'm gonna look at your ears now. So I'm gonna pull up and look inside. On the other side. Oh, there it is. Any changes in hearing at all?
No.
That's good. Had to do it. All right, so I'm kind of tap your forehead. These are like where your two sinuses are on your forehead. So just let me know if you feel any pain, okay? Any discomfort?
No.
All right, so I'm gonna feel kind of around your neck. I'm gonna feel your lymph nodes, and then I'm also gonna feel your trachea and kind of see if it's in line, okay? So I'm gonna start back here. Any pain when I was touching there? Okay, so I'm gonna touch your neck now. For your thyroid, kind of move it. Any pain there?
No.
Okay, good. So everything seems good from your head to your neck, okay? So next we're gonna go to your arms. So I'm gonna kind of feel your skin. Make sure it's warm. I'm gonna test your skin turgor. So pull up on the skin. Let go. Look at your cap refill. Looks good. Will you squeeze my fingers for me? Good. All right, I'm gonna put my hands on your arms. Will you press up? Good. Press down. Same thing with your hands. Press down. Press up. Good. Range of motion, will you just move your arms up, down, and then in front of you? Any pain with the range of motion? Good. I'm gonna press on your shoulders. Will you just press up for me? Good. You move your neck side to side, up, down. Looks good. Awesome. Is it okay if I check your back out? Perfect. Looking at the skin, feeling warmth. Looks good. Also, I'm just looking at your posture now. Do you have any back problems, any back pain, sitting for long periods of time?
Not really, no.
No? Okay. So I'm just kind of looking at your chest too, seeing if you have any, looking at your skin as well. Sorry. All right, looks good. Perfect. So I'm going to listen to her heart sounds, her lung sounds, and then we'll keep going down. I'm going to start with your heart sounds, okay? Sorry, I'm on your skin. I'm going to go kind of underneath your breasts, okay? And this is her apical pulse, so I'm going to listen for a minute. Perfect. So I said 68 before. It was around 70. So that's good. All right. So I'm going to also do your respiration. So each time I move my stethoscope, please take a deep breath in and out. Okay? So go ahead. Sorry. you lift your shirt up for me? Thank you. It's kind of hard to do 8, but you would do 8. All right, and then could you turn around for me? Is it okay if I lift your shirt up?
Yep.
Okay. So you do 10 on the back. So in and out. Try to sit up straight still. Sorry. I am lifting up her bra every time so it's on the skin. All right, well done. All clear and equal. Sorry, you can readjust your bra if you need to. Okay, sorry. All right, so then we're gonna move to her abdomen assessment before I get to her legs and do all that stuff. So could you please lay down for me? Maybe you head that, yeah, maybe head that way. All right, so first I'm going to look at her body and her stomach and her chest and make sure it's all in line. Some people could have a scaphoid chest, which is more indented, concave. Some people could have a barrel chest, which is more rounded. So we're just looking at all of that. Do you have any pain in your abdomen at all?
Mm-mm.
Okay, perfect. So since she doesn't have any pain, we're going to start from the right to the left. We're going to inspect first. We inspected, so then we're going to listen. You can just breathe normally. Awesome. So I also listened for any roots in her abdominal aorta, but nothing's good. So then we're gonna palpate. So I'm gonna kind of press like lightly on your stomach. Okay, I'm not gonna press too hard. So we're just feeling for any underlying issues, any masses, any pain when touching or like not touching. So rebound tenderness, good. No discomfort?
No.
Perfect. All right, so you can go ahead and sit up. Thank you. I would then look at her genitalia. I would look at her rectum. You would look at the skin. You would look for any abnormal discharge, any changes in skin texture. For the rectum, we look for any redness, maybe some hemorrhoids, maybe some fissures. So those are like little cuts in the anal area. So you want to look at all of that. Obviously not going to do that right now, but yes, you want to make sure you do that. So before I move on to the lower extremity, I'm going to check all your pulses on your upper extremity. So I'll check your radial, brachial, one at a time. All right. So make sure you assess the skin all throughout that. So I felt her back, I felt her stomach, everything. Okay? So move on to the legs. It's okay for the trunks. I'm gonna feel the warmth. I'm gonna check her feet again. Sorry.
so cold.
I'm sorry. I'm gonna check in between her toes. I'm gonna check her feet. All of that. So it feels good. Any pain when I was squeezing your legs at all?
No.
Perfect. I'm gonna check her skin turgor on her foot. I'm gonna check her cap refill again. All of that. Perfect. I'm gonna check her musculoskeletal. So I'm gonna press on your calves. You can press backwards. Perfect. On your shins, press forward. Great. For her feet, I'm gonna put my hands underneath her feet and just gonna press down like a pedal. So press down. Perfect. I'm gonna put it on the top of your feet, press up. Great. Great job. All right, so then can you extend your legs out?
Both?
Yep. And then down. Then can you stand up and kind of massage your hip joints? So just move legs out. Nice. Forward. Any pain at all?
Mm-mm.
Perfect. You go ahead and sit down. And check your pulses. So I would check her femoral pulse, but that's all up in her grind. I'm gonna check her popliteal pulse. Usually you can't feel that, so you would have to get like a Doppler for that as well. And then inside of her ankles. Also going back to her rectum and her vagina, so you want to ask her bowel habits and her urinary habits. So it's important to ask when her last bowel movement was. You don't have to answer that. If she has any burning when peeing, any changes in frequency, anything like that. For women, it could be pregnancy.